Well, good evening, everyone. I'm standing in for the chair, Peter McCabe, who is running late and will take over the meeting when he gets here. The first item on the agenda for this evening is apologies for absence. Do I have any?
Vice Chair, we haven't had any apologies for absence.
Thank you. The next item on the agenda are minutes of the previous meeting. Can we agree the minutes of the previous meeting? Thank you. The next item on the agenda is declarations of pecuniary interest. Does anyone have a declaration to make? Councillor Dollimore? Thank you. I'll now move on to agenda item 4, which is the impact of COVID in Merton. And I believe Dr. Dagmar Zoyner will update us on that. Thank you.
Good evening, Chair. Good evening, committee. If you may allow me, you've got the full set of slides in your pack, but this is from end of January, and the pandemic has moved on. So with your permission, I just will give you the highlight overview. And this time it's good news. Indeed, the infection rates have come down further. So the overall situation is the important number R is below 1, which basically means the pandemic is finally really shrinking. Now, there are still relatively high numbers of infections, particularly in schools. So any of you with school children, it might not quite feel as positive as I'm describing it, but the trend even in schools is improving. Equally in hospitals, hospitalizations have slightly reduced now. And in terms of COVID vaccinations, the progress has slowed down as well. You will remember that before Christmas and between Christmas and New Year, there was the so-called sprint where we had a really big push and success on the booster vaccination. That has now really slowed down, but the whole purpose now of our work very much with the NHS is to leave nobody behind and to do rather smaller numbers, but very targeted efforts. And you will see in your slides, albeit small improvements in groups, there are still improvements, including first and second doses, not just boosters. We're also working on the 12 to 15 year olds. And then for the 5 to 11 year olds, you will have heard that the children at high risk are also being offered the vaccination. So where we're now starting to focus on is what does it look like living safely with COVID, and what is the role of local authorities going forward vis-a-vis the UK Health Security Agency and our NHS. And as we are planning to live safely with COVID, we're also planning what if, so being prepared for potential further surges. We are simply not having the crystal ball, so knowing whether there will be other variants coming our way and what will happen to the population immunity. So that's happening behind the scenes, and the planning. Cabinet Office nationally is planning, and then London and sub-regional as well as local. So that's a quick canter through my update. Thank you.
Dagmar, thank you very much. That is mainly good news. Has anyone got any questions for Dagmar?
Thank you. Just with the lateral flow tests, they changed now how you register, or you don't. I'm assuming people aren't going to be registering so frequently. I'm just wondering, with the mid to long term plans for COVID surveillance, whether that might change.
Yeah, I think it's a really good question. So the whole issue of surveillance, because the surveillance obviously happens through the PCR testing, through the LFT testing, and then really importantly and probably most robustly to the national surveys, so that people, a random sample, a large random sample of people are regularly tested. They have agreed to participate, and that actually gives us probably the strongest picture. And understanding living safely with COVID and in terms of the surveillance function, our assumption is that the national surveys are going to continue, but that we rely much less on testing. Because, as you say, lateral flow tests are anyway not reported back, and we are assuming that longer term, the PCR testing will be more for hospital cases to access the therapeutics, and, as we said, for the national survey rather than for everybody. But that's the type of planning. We are now waiting initially for the national plan, so we can adapt locally.
Can I take Linda and then Helena?
There's been talk of further variants. Is there anything on the horizon?
Yeah, you probably have heard in the current variant called Omicron, the original Omicron. It also has a rather sort of unimaginative abbreviation, BA1. There is a further mutation of this variant, which is called BA2, which is actually spreading, and it's spreading globally. It is also spreading within the UK. You might have heard Denmark, for example, has some predominance of this strain. Now, the important bit is it's probably even more transmissible than BA1, but so far it doesn't seem to have any significance. So in terms of immune escape or severity of disease, it doesn't seem to be different to Omicron. And so this country is very good in the genotyping, so they are very much on the ball with the surveillance. And what they tend to do is they allocate the names. So this is now a variant under investigation. We call it a VUI. And only if there is concern that the impact varies from Omicron, they would up in their consideration to a variant of concern, a VOC. And at the moment, there are no signs that BA2 will be regarded as a variant of concern. The good thing is, in a way, this virus is going to mutate. That is almost a given. We are not sure which way it's going. Generally, it is understood that the mutations seem to produce milder disease, but we do not know. And that's why I said, living with COVID, we have to keep planning and preparedness for potential future surges. The UK is very well endowed with genotyping, so that is a real advantage, so that we can pick it up early. But the BA2 is the only one at the moment under investigation.
In end of October, how long is that likely to be protective?
Sorry, Councillor, I missed the first bit of the question.
I had a booster at the end of October. How long is that likely to be protective for people now, the booster?
Yeah, it's a good question. So as you are aware, the the Omicron variant has been showing some immune escape. So roughly people say for transmission prevention, that's quite important. It's probably, 3 to 4 months. But the important bit is that the expectation of immunity to prevent severe disease is assumed to be much longer. So there are discussions, and you probably will have had friends and colleagues that have said, I even got Omicron after the booster. So the booster cannot prevent totally transmission, but the data from the hospital very clearly has shown us that despite so many infections and reinfections with Omicron, the hospital admissions have been steady, and severe disease, so people on ventilators, have actually been much, much lower. So the booster is really holding up against serious disease. And it probably, because you will ask me the next question, is there another booster coming along? Because that is, I think, a very legitimate question and consideration, and I haven't got the answer. This is obviously thought about and discussed at national level with the help of the JCVI, so the Expert Immunization Committee. And so far, this country hasn't announced anything. You will be aware that I think the only country that has given a 4th regular dose, so a 2nd booster, was Israel. And there is still learning going on whether that is or isn't the recommended way to go forward. So watch that space.
Thank you, Dagmar, and as ever, thanks for the update and all of your work and your team's work on this. 2 things that we've talked about in previous meetings I wanted to look at in the data. First, on page 9, you'll see the number of deaths of Merton residents by the week. And we've talked before about the number of deaths in homes and why that figure is higher than 1 in 10 of the deaths have happened at home. Is that usual? Is that what we would expect? Perhaps these people might be having end-of-life care. I don't know. I'm interested in some thoughts on that. And also, I am worried about this issue for immunocompromised people. So we know that the booster and the vaccines provide a great deal of protection against severe disease, but for those who are immunocompromised, not so much, and they are still really at risk. And as I understand it, they're eligible to get another dose of the vaccine, but there seems to be very little understood about this. It's being communicated patchily. Some people are hearing the news, some people aren't. Even the fact that we're talking now about the 4th dose in Israel, as opposed to the 4th dose for the immunocompromised, I'm just concerned that we're not reaching those most vulnerable people in our comms efforts.
Thank you very much, Councillor. 2 really good questions. So if we first have a little look at the graphs of the deaths, and we are planning to bring a little bit more of a deep dive into who died of COVID over all the different waves to the next committee, because it requires a bit of elaborate data gathering. But just to let you know, the deaths at home absolutely include people at the end of life, and the majority of those were at our highest peak, which was in the first wave. But I think it would be best if you in a way allow us to bring a proper report, because a really legitimate and important question to scrutinize. Your second question about vaccination, particularly for immunocompromised people, absolutely spot on. And it's very important that we are not really talking for them about boosters, because they haven't got a lot of immune response, but a 3rd and 4th dose. Those patients should be directly contacted by their clinicians. A number of them are not only under primary care, but also have secondary care clinicians. But I think you are absolutely right that it is very, very important that it's also understood so that nobody slips through the net. So I take that back as a really good point. For our comms people, and just a slightly different angle, but also hopefully helpful, is that those who are immunocompromised will always have a higher risk despite additional immunization doses, and they live, to be honest, in quite a lot of anxiety. So we've spoken to a number of them, and what some of their support will be is quick access to therapeutics, because the advance now, very different to first and second wave, is that we have antiviral therapy available as well as antibody therapy available. And again, this is organized through the NHS, that primary care has a list of all those people, and they are asked now and supported to get PCR tests so that they have them at home. And the moment they feel they get symptomatic, they test, and if that test is positive, it triggers a community response, community access to therapeutics. And this has only just started. You will remember it was announced not that long ago. So we are working very closely through our community champions as well, to make sure that people are aware of this additional, in a way, service for the immunocompromised. And it is a good opportunity when we are anyway making that contact to let people know about the access to the therapeutics and the importance of their additional dose of vaccination. So all in all, that is this sort of approach we're trying to mobilize for these particularly vulnerable people.
Just thanks, Dagmar. Just on that point about people who are immunocompromised who do get COVID, I had a resident who that happened to recently, and they had to go to Slough for the therapeutics, which was quite a long way. Can people get that locally? They also found that the system didn't work that well. One nurse told them one thing, another clinician told them another thing. Eventually they went to Slough. So I just wonder how that is actually working in practice for people.
Yeah, so again, obviously this is an individual case. So if you need that to be followed up, I can help, but there's obviously consent issues, so we will take that outside. In principle, yes, it should work, but it is fair, and I'm therefore not completely surprised but disappointed that the setup of the service has only just started. So it is actually really helpful to hear when it doesn't work, so that we can improve it. But as I said, we're working very closely with our NHS colleagues to develop the service so that it is much smoother. And you pointed to really important things. It means training for all the frontline staff. So the patients themselves need to understand, and then the whole service and surrounding frontline staff needs to be up to date. So I'm not completely cited around the details, but having to go to Slough does not sound like the optimal service. The plan is that these drugs will be available locally in the community. So I will, it's a good point that you reminded me, so I will take it back to discuss again with our primary care colleagues.
Jennifer?
Thank you, Dagmar. Just around children in schools, I didn't see any statistics for COVID cases in the 5 to 11-year-old. I know you were saying that there were many cases, as we know, in schools, and I'm just wondering whether you've got any more information about vaccinations. I think you did mention about high risk. And also just an additional question, if there are any, maybe not for yourself, I don't know, but are there any additional funds for schools struggling to pay the heating bills due to COVID, with the ventilation measures that have come in, obviously with the windows and doors open, if there's any additional funding available? Thank you.
Yeah, so first of all, on the numbers, infection numbers in the youngsters, they had gone up. So in your slide said they were on the way up. They have now stabilized. Indeed, the very latest figures, but we're always a little bit cautious before we celebrate, seem to have stabilized, if not going down. The really important bit for me and the children is recent research being published really convincingly showing that the health impact on children with COVID is very mild. Now, when they're sick, they obviously still have to stay at home. And so an outbreak in a school is an undesirable event because it disrupts education. But from a health impact, we're really, really relieved that the Omicron variant hasn't come out with increased hospitalization in children. So that's the good news. Therefore, the vaccination that is planned at the moment is only for high-risk children. Again, the Joint Committee for Vaccination and Immunization, JCVI, they are still looking at all the data from across the world about vaccinating universally 5 to 11-year-olds, but it is certainly not considered as a control measure for the current infections. For the current infections, the vaccination isn't a general control measure, it is an individual protection for children at high risk only. And then about the specific funds for ventilation, I have to give that one a miss and find out. I have not got that up my sleeve.
Thank you, Dagmar. I have one question myself. I'm pleased to see there's a small improvement in the communities and their encouragement to take up the vaccine. There's been a lot in the press about pregnant women being very hesitant because they fear it in some way it will harm their babies. Is there anything specific you can update us on to give us good news on how you're targeting that particular group? Thank you.
Yeah, so it's a really a good point, Councillor, and you probably heard me speaking about this before. We've mobilised not only locally, but at London and at sub-regional level, so pulled together with particular trusted clinicians or obstetricians, obstetricians from particular ethnic communities as well, who have pulled together and pulled a lot of resources together, so video clips, webinars, Q&A sessions, and there was a big open session, a London-wide session that we have sort of distributed very widely to our networks and communities through our community champions, and to our, for example, schools and teachers, because there is again vaccination rates not that high, and sometimes fertility is an issue. So we're trying our really best to make inroads. And the last time I spoke to my NHS colleagues around rates of unvaccinated pregnant women in hospital, because that was obviously the saddest, in a way, most tragic outcome. Luckily, with general community transmission going down, that was also going down. But that is certainly a group that we are having ongoing engagement through our maternity services as well, through our health visitors, because it is, we have seen some tragic pregnancy outcomes in unvaccinated women.
Thank you. Are there any further questions? In that case, thank you very much, Dagmar, for your update. I will now take the next item on the agenda, the immunisation programme in Merton, and I believe one of our NHS England colleagues will be taking this.
Hello, 1 second, I shall start my video. Hi, my name's Catherine Heffernan, and I'm currently the Principal Advisor for Commissioning Early Years Immunisation Vaccination Services at NHS England Improvement London. And I'm here with a couple of my colleagues. My colleague Jackie Walker, would you like to introduce yourself?
Hi, my name's Jacqueline Walker. I'm Operational Director for COVID and Flu immunisation programmes for the London region at NHSEI.
My colleague Ellie, who's listening in.
Hiya, I'm Ellie and I'm the Immunisation Officer for South West London, Commissioning Officer.
And I believe we have our ICS lead, Una, who leads on immunisations with us. Or maybe not. Might be just us. We do have another colleague, Bernadette, who unfortunately is ill this week, who can't be with us. So would you like me to give a quick overview, or would you like me to take some questions?
If you could just a quick overview. We've all, I think, read the report, but just a quick overview, then I'll open it up for questions. Thank you.
Okay, Jackie, do you want to fill in on flu, and then I can pick up on the other adult vaccinations?
Yeah, certainly. So with regards to flu vaccinations this season, there were really high ambitions set by our national colleagues with regards to achieving a much greater uptake, which we recognised as a London region were very stretching for us based on previous years' uptake across the different cohorts. So our regional plan was to achieve a greater uptake than last season, and absolutely want to achieve that year on year, but recognising the challenges in achieving a greater uptake, particularly in light of the expanded cohorts that we saw this season and the eligible populations we had to reach, but also in light of the COVID vaccination programme running alongside, and also the circulating COVID-19 infection, which has impacted on some of the vaccination work. And just to note, the data you see in the report, that data reconciliation coming towards the end of the season is still underway. So it's not final data, it is the current published data that we have available via the UK SHA or HSA, sorry. So there will be further work done on ensuring there's further data entry and uploading to ensure a more accurate position towards the end of the season. So to note the regional rates with regards to flu vaccination this season, we've only exceeded last year's rate for the 50 to 64-year-old cohort. So we've experienced lower rates amongst clinical at risk, the under 65s at risk, pregnant women and 2 to 3-year-olds. And that's demonstrated in the table, in table 1 you see in the report. So that's our position in that table as well compared to the rest of England, so it's to note that, and you will see some commentary following table 1 in relation to the England average and the uptake for those primary cohorts as well, where we have seen nationally a lower uptake amongst pregnant women and in the 2 to 3-year-old cohort. For age 65 and over, there has been a higher uptake nationally, and we're slightly under in relation to the region, and then the at-risk groups, that's comparable nationally. So it's just to note that comparison. So all CCGs across London have performed below the national ambitions, and those national ambitions, as I say, were very stretching. They were 70% and above, but ranged up to 85% for some of the cohorts. The committee should note the various elements that have affected the delivery of that programme this season, and we've referenced those on page 24 and the top of page 25. As I've said, we have had to deliver the flu vaccination programme alongside the COVID vaccination programme, which was an expanded and accelerated programme once Omicron hit at the beginning of December. We've had to really increase the work done around the booster programme particularly, and that really affected us really trying to drive further forward uptake in December, particularly for flu vaccination. And certainly for school-aged children, that programme has been affected by the delivery to the 12 to 15-year-old healthy cohort in relation to COVID vaccination via the schools programme. So there was that competing priority alongside other school-aged immunisations as well. We do tend to see a peak in demand in sort of October time with regards to flu vaccination. And what we have experienced at that time is sometimes then a lack of stock with regards to that early demand, and then access to the national flu stock not coming through in a timely way to actually meet that demand. So that's something we really need to look at for next season, in how we make sure that we've got adequate stock ordering to achieve greater uptake earlier in the season. And when you look at previous seasons for flu, the earlier the uptake and better uptake early in the season, that demonstrates and follows through with regards to a better uptake through the season and a better result at the end of the season as well. And we also saw in pharmacy, and I've referenced that in the report, we saw a fantastic contribution by community pharmacy with regards to their delivery of vaccinations for flu this season, at 72% increase from last season, and nearly 30% of total vaccinations across the capital. That was 235,000 more than last season. So we really want to strengthen that arrangement with regards to community pharmacy being seen as a really important delivery model that we've learned through COVID vaccination, but really to support our flu vaccination moving forward for further seasons as well. But again, pharmacy reported quite a peak in demand where the stock then did not match that peak. The figure 1 in the report references the Merton borough uptake. So it's to note that specifically in relation to the London average, and then the performance across South West London Health and Social Care Partnership. And to note that there was a really good performance with regards to being greater than the London average for under 65s at risk and for pregnant women. And also Merton was on par with South West London average for pregnant women as well. However, for over 65s, Merton was below South West London and London average. So obviously it's to note that with regards to the performance there. And then finally for flu, we've noted some work that's happened across the region with our ICS colleagues. We've been meeting on a weekly basis via the London Flu Delivery Group to really look at the interventions that have been happening this season. Very importantly, the learning from the COVID vaccination programme and what further work we could do around flu in relation to that. And also there have been specific work stream areas that we focused on, and Ellie's here, who's been leading on the health inequalities group that's been meeting weekly as well, in bringing the different systems across London together with key partners in having a real focus on what the data is telling us around deprivation and ethnicity, and really looking at those health inclusion groups as well, and the harder to reach groups. So I think that's been a really valuable piece of work in understanding our position this season, but putting us in a much better position for forthcoming seasons in the work we need to do there. So I'm going to stop around in relation to flu and hand back to Catherine.
Great, thank you. So following that on, basically for shingles vaccine and for PVV, they have been, they have been negatively impacted by COVID-19. Shingles had been already declining right across the country, and more so since COVID happened, because of for the first part of the pandemic, that was actually one of the vaccines that they stopped access to. But we did do some work before Christmas to retrain all our general practice staff across London on the importance of the shingles vaccine. It is a very important vaccine, often forgotten vaccine, and we reinvigorated our shingles toolkit that went out to every practice, which we will evaluate impact later this year. So really, a lot of effort is going in to try and improve uptake of shingles. And then PVV, the pneumococcal vaccine for the over 65s, that has had a positive history in that we've had difficulties with shortage of the vaccine in the past. However, a national stock of it was acquired last year. So we're hoping that going forward, there'll be better access to this vaccine, and there we can have better uptake. So that's all for me. So any questions?
I think I saw Linda first, then Helena, and then Jennifer.
Mine's not so much a question as I normally never have the flu vaccine, but this year I did, or the last year I did. Because I think of the focus around vaccination generally around COVID, and I think a lot of people's minds will have been changed. I know we're not dealing with child vaccinations here, but I know a member of my family who hadn't had her children vaccinated. I was surprised when they had the COVID vaccinations. So I think that what's going on is had a massive impact on people. Because it's been so scary. I think the word vaccination now is probably lost some of the toxicity it got when people were campaigning against child vaccinations. And certainly I think, from my friends, that everybody I know has gone and got flu now. And so I think it's been very, very powerful, really. A lot of very good work going on.
Thank you.
Helena?
Yeah, thank you very much, Catherine and Jackie and Ellie, for all your work, because I'm sure there's been a lot going on with the COVID vaccination programme, as well as all the other immunisations that have to keep going. Obviously, shingles, as you kind of pointed to, that has been impacted by the pandemic. And that's a discussion that we had at a previous meeting about, are we going to see a drop off in some of the routine immunisations? I did look at the figures for MMR vaccines. I know they're in the news last week. It's not strictly the subject of this report, but I just wondered, given it's been in the news and we are about 5% below the UK average, if you could just talk a little bit about that. And also, my concern with looking at these figures is that we bunch everything as Merton. And I understand that's how the NHS organises it as a CCG and now as an integrated care system. But we have wide inequalities in Merton between the east and the west of the borough. And I just worry sometimes that by not looking at the ward by ward figures, we might be masking gaps that we need to look at and cover. So perhaps you could just talk a bit about that as well, and particularly around MMR, given the recent concern.
Sure, yeah. So I'll take that first about the difference in variation uptake. You're absolutely right. And I actually did raise this within NHS England with our analytical team. I did point out that actually when we go to scrutiny or we go to health and wellbeing boards, we're always asked about what's happening at borough level and within boroughs. So we do need better access to that data. We did in the past, but COVID threw a lot of things out of the window. So the analytical team will get back and do that. We won't necessarily have uptake by ward level. We will have it at GP practice level. And certainly we did do just before COVID a big piece of work called the Serving the Underserved, a plan for London, looking at health inequities and inequalities and uptake of immunisations. We did the first macro looking at it across London, the impact of deprivation and migration and the associations between those and uptake. And then we started drilling down at a GP practice level. Unfortunately was paused because of COVID, and we restarted that work just after Christmas, actually. So it's quite new. So hopefully I will be able to, well, actually I won't be here, sorry, because I'm moving on to another job, but hopefully my successor or the team will be able to provide more detailed knowledge on that going forward and work with the local public health team on that. But I fully get your point on that, and I have raised that we do need more micro level information so we can actually see what's going on the ground. In relation to MMR, yes, we were very well aware of the MMR campaign, and it's very much welcomed. I personally really worry about the impact on 0 to 5s vaccinations because of COVID. So we've pulled out our MMR recovery plan, which was paused before or paused because of COVID. We have brought it up to date with the latest evidence, the latest figures. And we met today, actually, pulled together a clinical network of people today. And it's going to be a pan-London work led by one of my colleagues, Priyanka, who's the senior immunization manager who focuses on 0 to 5s. So there's a huge work stream going to go ahead with that. Very, very keen to ensure that people have their vaccines timely. One of the things we're very good at in London is that people are delayed in having their vaccinations, so they're not delayed by they're not vaccinated by the time or the markers in the science that we measure our vaccination uptake, but they have it then later as older kids. But of course, in doing that practice, some kids then get forgotten about, or parents forget that their child hasn't had what they needed to have. So we're working very much too on making sure that people are vaccinated as close as possible on the childhood routine immunisation schedule. So there is work going on across London, including South West London, with the ICS to really bring back that practice of call recall, and then working with the practices, working with the PCNs, working with the ICSs to ensure that kids are going to get vaccinated on time. So there's lots of stuff that's in the mix there. We're going to roll out reducing missed vaccination opportunities across all our practices. We've plans to do an MMR toolkit where there will be webinars, more training going on this year in updating people's knowledge on the impact of measles, mumps and rubella, because they are serious infections and diseases, and they do cause considerable mortality and morbidity, and especially with the impact of the pandemic. And as travel starts up again and we've people moving between countries, around within countries, we could actually expose ourselves to future outbreaks of measles and mumps. So it's very much on our risk register and very much something that we're very keen to roll forward.
Thank you. Jennifer?
Yes, thanks very much for the information you just gave us. That was very interesting. I'm a bit concerned about the vaccinations for flu for pregnant women. It says the vaccine uptake is lower than the same period last season and lower than the previous 7 seasons before that. I'm just wondering whether you know when women go to their first booking appointment, whether they're asked whether they've had the flu vaccination then, if that's something that they could be looked at. And also, second question is, it says Merton did not meet the national ambitions in any of the primary care cohorts. Could you just expand on that and just explain what work's being taken? Thank you.
Yes, certainly. So with regards to maternity services, that is part of our plan in relation to reaching pregnant women to support them in making a decision about taking vaccinations, whatever those vaccinations are, and that's certainly the case for flu. So we've done a lot of work with our maternity units in promoting flu vaccination and actually delivery within maternity units of that vaccination as well. And that's certainly part of the trust letter that goes out to trusts to encourage opportunistic vaccination within acute care services, so that whether that's a pregnant woman or someone at risk or an older person being discharged to a care home. So there's certainly collaborative work to try and ensure that those within eligible cohorts, of which pregnant women are, that there are various opportunities for them to access the vaccine. So absolutely promoted. In relation to the national ambitions, so these were national ambitions set for each eligible cohort referenced in the national flu letter. Those were very stretching this year in light of COVID infection and the risk of vulnerable people contracting COVID and flu at the same time. So there was a real push to really improve the uptake. Now, as I said when I referenced the information in the report, we knew those were hugely stretching for London, and usually London performs less well than the rest of the country with regards to the challenges that London has in relation to its population, but the rest of the country haven't been able to achieve those heightened ambitions as well. So they, as I said, they were really far-reaching and stretching, but our ambition was absolutely to achieve greater than last year. And because some of the challenges in relation to delivery, that has been difficult to achieve across the cohorts. I will say we've had 75,000 vaccinations delivered in the capital that have been part of a co-administration event, where COVID vaccination and flu vaccination have been delivered at the same time. And we were really aiming to promote that well with our population of London, in looking for those opportunities. And I know providers have been looking for those opportunities to deliver on that. Some of the difficulties were around the availability of the vaccine across both vaccines with regards to delivering at the same time, and the different delivery models, etc. But that's certainly an ambition we're going to take forward for next season, and obviously dependent on what the approach will be based on JCVI guidance for further COVID vaccination. So I think there are lots of opportunities moving forward to really promote flu. Certainly vaccinations have been given a much higher profile in light of COVID. So we'll certainly be making the best use of that with regards to flu vaccination for next season. And as I said, learning from that COVID vaccination programme as well.
Nigel?
Thank you, Chair. I was going to ask the same question, but she asked the question. Anyway, therefore, my second question is on the headline in London, and I understand you had to close down or pause, throughout the COVID, and now you're going to meet up again next month. What are you hoping to achieve from it, and what are your main priorities for merchant and of course London? Thank you.
Sorry, can we ask who that was directed?
Yeah, which program was that about?
Sorry? to me speak like say about it. What I was saying in terms of the headlines for London on page 22 or page 4 of your report. And if you look in the last paragraph, you said throughout the COVID bit you closed down, and now you're meeting up again next month, March 2022, which is next month. My question was, what are you hoping to achieve, and what are your main priorities for merging and across London? Thank you.
Sorry, can I just check that with the chair? Was that in relation to our flu wash-up event, in relation to learning from this season for next season, please?
It's in relation to the London Immunization Partnership Board, which was paused.
Oh, yeah.
And is expected to meet again this March. And I think Nigel was asking about, in specifically when it meets, what are the priorities for Merton?
Okay, so the London Immunisation Partnership Board paused during COVID mainly because most of the members of the board, myself included, were working on COVID. As you know, in September 2021, Public Health England ceased to exist. So the system is in a bit of a flux at the moment. We're not quite sure what the governance structure will be for immunisation, Section 7A immunisation programmes going forward. As well, as you know, there is the movement towards ICSs, ICBs, and towards place-based commissioning. So the whole thing is in flux. So Will Hoxter, who's the Director for Public Health and Primary Care Commissioning, has penciled in the diary for the board to come together again in a new form in March, but this has yet to be signed off by senior leadership within NHS England. And the idea being is that this board would be a partnership board where people would come together from across the system. So local authorities would be represented, GLA, there would be representation from the ICSs, from patient and public representatives, and to come together and to determine what the strategy is for London and its immunisations going forward. So the first meeting would be looking at that and what the priorities will be for London. But as I say, it is a system at the moment, sort of, it's had COVID happened, it's had this change around Public Health England, and then you have the emergence of OXA and the emergence of Ofwat. So it's trying to work out whose role is what in this new landscape. So I'm afraid I can't give you any more details than that. Other than that, the priority will always remain for NHS England in that to protect Londoners as best as possible from vaccine preventable diseases and to reduce the inequalities and inequities in access to our vaccination programmes.
Any further questions? Well, thank you, Catherine, Jackie and Ellie, for your time and your patience in answering the questions. Thank you.
You're very welcome.
I'm now going to hand over to the chair, Peter McCabe, who has joined us.
Thank you, Janice. And can I apologise to colleagues for my lateness? I got stuck en route. And we're going on to the review of lunch clubs in Merton. Simon, I can't see you. Are you there? Oh, yes.
Yes, I'm there, yeah. Thank you, Chair.
Camera turned off. Over to you.
Okay, thank you. Good evening, all. I've obviously provided a summary paper, but I'll go through it in a limited amount of detail, and then if anybody's got any questions, obviously I can go back or pick up on them. The original Lunch Club programme, as it was termed, was started in early 2020, which I joined MVSC as it then was, now rebranded as Merton Connected, in January 2020. So stepped into the initiative early doors. And as you'll see from the paper, if you've had a chance to read the detail, is that the original project description was to review the current number of lunch clubs that were running in the borough, providing great service and very valued, but to look at how they might be more sustainable in the long term without a reliance on London Borough Merton funding, which they were receiving at the time. The initial plan in that project description included a presentation to the Improvement and Development Board on the 27th of February 2020, with a plan to work quite promptly moving into the next financial year to address each lunch club, its financial viability, its operation, and try and move them forward. The original project scope then had 3 different stages to push through, initially for the financial year up until March 2021. But as we'll all remember, unfortunately, is that the pandemic hit in March 2020, and because of restrictions, many of the lunch clubs could not operate in their usual face-to-face manner, and this situation continued actually until quite recently, as we all know, with some sort of bumps and starts in terms of them being able to provide some service, and then lockdowns as well. And I'll also talk about the impact on many of their clients, the residents they support through the lunch club network, and some of their reticence even now in returning to those sorts of services. So like I say, the original project scope, which is under points 2.1 to 2.4, were what were planned at the time before the pandemic hit. And a budget was agreed with LBM and a project plan and the monitoring regime that you would expect to run through those stages. If you go on to the second page under point 3, the lockdown sort of goes without saying that it had quite a dramatic impact on a lot of those organisations. And many of you will be aware that they just couldn't operate, and actually many of their customers were having to self-isolate, and support in the borough through the community hub, through the Merton Giving Scheme, etc., was helping those individual customers, because there was a gap where lunch club engagement and socialisation was taking place. In that early first lockdown period, it was agreed with LBM that we'd recalibrate the project and not actually close it down, but actually take the initial funding that was agreed and stretch it quite simply with regular reviews depending on the nature of COVID restrictions and access of residents, to try and keep things moving with the lunch clubs, and there were originally 14 involved, to try and progress in readiness for the hope that obviously they could sort of spring back into normal activity. And so there was activity throughout that period. It was just much slower than what was anticipated to actually address the situation in that financial year up to 2021. There was obviously a regular review regime with the project team in London Borough Merton, so we could sensibly flex and stretch based on what the pandemic was throwing at us, particularly in terms of restrictions. What actually happened is, like a lot of things, it moved to an online sort of workshop model, which is point 4 in the paper. So one of the opportunities was, and the initial assessment said that the majority of lunch clubs were all working in isolation. They weren't typically even talking to each other. And when we come on to the simple map of where they sit, many of the lunch clubs are actually in quite close proximity to each other, but they were almost without exception were working in silos. Some of them with good financial support, good governance, some of the smaller ones with lesser infrastructure, if you like, support in their activity, and are very much a hand-to-mouth sort of approach, with fantastic commitment from the organisations and their volunteers and their teams that were running them. So it was agreed that what we try and do is work with the whole network, and Peter, who did the sort of project management stage of that, started up an online workshop structure. So as you'll see under point 4.2, that was to encourage all the lunch clubs, large and small, to share the sort of challenges and the successes they were experiencing through that bumpy period of the pandemic. You know, being able to open, then being locked down again, you know, their clients not being able to get to the lunch club because transport options weren't available, etc., etc. It was also a way of actually creating a network, as we've done with other things like food network support in the borough. And it was about really collectively making them realise they weren't on their own, that there was things like the Merton Giving Scheme that could continue to help them through the difficult period financially, while they couldn't operate and couldn't get income from residents who contributed to lunches and other activities that they did. And under point 4.3 there, you'll see that there were regular lunch club roundtables, as they got to call. So it's a bit more inclusive. And actually, rather than the original 14 lunch clubs, 3 of the food distribution groups, so the likes of the Wimbledon Dons, who I think most people know have done such exceptional work through this period, and also Moat Housing also joined in the network to try and give support and help. And basically that program has run every 6 weeks with some success. It's the sort of issues are covered under 4.3 there, how they manage through the lockdowns, how they might transition their services, consider working slightly differently coming out of the lockdown, and also the very real situation that most of us have dealt with, where they've got, you know, COVID restrictions, not when there's actual government restrictions, but with people catching COVID and having to isolate with both their permanent staff, any volunteers they've got, any transport that was normally used. All of those things, as we know, have been affected, and to luckily a slightly lesser degree, are still affecting their operation. They also, the sort of facilitation of that network also got them to look at wider things. And there's some examples there, you know, the Warm and Well programme, Moves Benefits Assessment Service, that many of those residents who would come to a lunch club and maybe couldn't, could still get access to, including the community hub, which I hope you're all aware is still running a support service for any residents of the borough for any concerns at the moment. And it might seem a modest sort of step, but Age UK Merton tied up with friends in St Helier and did a Fish on Friday initiative. And although that doesn't seem dramatic, it was about those organisations regularly discussing things, looking for opportunities maybe where they could share. And that's a theme of where I hope the programme will develop. if I move you on to page 3, there's just a simple graphic there of where those clubs currently exist in Merton. And you'll see there's a fair spread around the borough, and like I say, many of them are actually very close to each other. And I think there's some longer term opportunities there where they could actually look to share food preparation and other services, because if you've read the paper, you'll see the footnote is that lunch clubs aren't just lunch clubs. They're a much broader and potentially wider well-being and a social sort of service that supports many residents that are isolated. One of the things certainly in the last year that was promoted quite a lot was the potential of volunteering. Like I say, a number of the very small clubs had very limited resource people to provide the service, and if anyone wasn't available, as indeed often was the case in the pandemic, they struggled to provide the sort of service that they would like to provide to their customers. So we've engaged with the volunteer team in Merton Connected to engage with the workshops and look at how volunteering can hopefully be a long-term and sustainable solution to allowing many of these lunch clubs to continue to not just provide maybe the service they were before the pandemic, but actually to grow wider wellbeing services and link with other organisations where it's not just around a hot meal or food. So there's coming out of that, there's a sort of parallel activity of a lunch club volunteer managers meeting where they specifically focus on how volunteers can work not necessarily just in one lunch club, but they can work collaboratively to use that capacity. And you know, again, there's been some steps forward. Friends in St Heliers, you'll see on one of the bullet points there, has redesigned their volunteer engagement with that support, with that workshop, sharing best practice. So they've got more volunteer capacity to maintain how successfully it runs at the moment, and hopefully will develop along that, continue, of course. I mentioned transport, you know, remains an issue of getting many residents to a lunch club or that sort of social thing. And certainly, again, Friends of St Helier recruited a driver through the Dons local action group. So again, that was about collaboration that I think if this programme and this roundtable approach wasn't working, those sort of things wouldn't have necessarily happened naturally. Merton Vision, you know, another important organisation that's provided such a service, has again engaged in more volunteer management to support their residents re-engaging. And there's also a number of online references there to other wider sort of supports that could come into the network. And the final point there is there's been an initiative running that Merton Connected has been developing, which is called the Volunteer Passport, which is about having volunteers that can do more than one thing, and they have a sort of passport, so all their checks and their sort of availability is visible to more than one organisation. So again, that's a prospect, I hope, for organisations going forward. If I push you on to the last page, the current levels of attendance activity. The roundtable thing has been pretty successful in terms of engagement, but there's only sometimes about a third of the organisations attending the meetings and being able to engage. Some of that is COVID related, unfortunately, over the period. But I think, you know, being honest, that sort of positions the challenge of networking and getting collaboration with a lot of lunch clubs, as originally called, that were used to doing their own thing. Most clubs are running, and more recently they've been able to open up. And as of October last year, it was the last sort of detailed assessment. Of the 16 clubs that are now engaged in the network, 11 were open with 9 providing lunch. 4 of them had not reopened, combination of venue, staffing issues, etc. And 1 had moved to an afternoon tea model, and 2 of them do not provide lunch. And that's one of the things that again has been explored, is that again, it's the footnote really, is a lunch club isn't just a lunch club. It's about a social engagement and social support for so many residents that can use it as a sort of a conduit for, you know, meeting other people, getting all sorts of support, getting well-being activity, etc., etc. So the plans going forward, if I can sort of conclude on that point, the funding for the original project, although it was only over the original 1 year, it's been stretched through to March this year, so March 22. And in terms of the original plan, not all the anticipated outcomes have been delivered, but there remain a lot of opportunities, and actually engaging the network has established something as a network that will, I think, continue long term and support the sustainability of those organisations. LBM has committed to support the programme in the next financial year, so from April this year through to March 23, in a way to catch up with some of that work around sustainability and financial strength of the organisations, and possibly, I think, some more collaboration between some of the organisations. So in terms of what's still being worked on and still happening, the volunteer recruitment and management is still being pursued quite actively, both at you know, sort of lunch club delivery level and at trustee level for some of those particularly small organisations that don't have the level of governance that might assist them to move forward and be sustained. There's also Merton Community Transport, for example, has actively worked with the network, and there's a number of transport options being looked at to help allow residents to get back to attending. The sustainability issues remain pretty much around good governance, financial management, and self-contained viability without the requirement for funding, and supporting them, which Merton Connected does with other organisations in the borough in terms of their own sustainability financially, by bidding for other funds. So, you know, from other funds other than just those available in the borough, for example, through Merton Giving. And the sort of final point there is find a better name for the group. The roundtables talked about lunch clubs and were they community cafes. I think one of the problems with that, and one of the possible opportunities going forward, they do so much more and they are much broader than a lunch club. And I think maybe one of the things that will be developed is whether a sort of subtle rebranding will help more engagement and a slightly different perspective of why people might want to engage with a broader sort of well-being agenda, rather than just it's about you just don't turn up and have lunch. For most of them, that's not what it was about. It was just the sort of the hook and the pivot that allowed to get the groups of residents together and socialise and get support. So in summary, the review of the original plans, you know, like I say, was stretched. The primary thing from the original February 2020 position was to help and support the lunch clubs to have less reliance on LBM direct funding, so they could be more self-sustainable. I think there's still a lot of opportunity, and I think collaboration will help them to consider different options as we come out of the pandemic period. So, Chair, I hope that gives everyone a reasonable sort of counter through of the paper, and obviously happy to take any questions.
Thank you, Simon. I think that was very clear. And when you said that you weren't, when you arrived, you had a plan which changed very rapidly, I could identify with that. And I think many people will know exactly what's gone on over the last couple of years. And I think it's really important that we acknowledge the contribution of the luncheon clubs to the well-being of our citizens, and pass our thanks on to everyone involved. And can I thank you and your team for kind of doing this work in the most difficult of circumstances, and ask if there are any questions from members. Linda.
More comments rather than questions, that's okay. First of all, I wasn't on Scrutiny, so I wasn't aware of that earlier report. It'd be nice to see that. I'm involved, I'm the chair of the North East Mitcham Community Association, and we've got 2 lunch clubs there. And the Monday one, Young at Hearts, which is a activities club after lunch, is all volunteers. I mean, what we would like to have is more activities and more times for them to meet, but we are totally relying on volunteers, and our volunteers are getting older as well. I would say about Merton Community Transport that they are expensive and are not very reliable, and that has been a big issue. And so we're looking to see whether or not we can recruit local people to transport people in who will be reliable because of the local connection. I'd like to know what funding you've got, because the lunch club never spoke to me about any of this, so I'm not sure whether or not they're engaging with you. But I'd like to make sure they were. One of the things we did with the community centres, we had a federation which we set up, but sadly that's not meeting at the moment. But when it was meeting, it was very helpful because everybody could share their problems, connect together, and it gave us a sort of strength of purpose, really, and you know, understanding one another's issues and supporting one another. So I think the idea of that collective, I would say on the map, when you think they are very close together, I can tell you the ones in North East Mitcham aren't close together at all. There's railways in between, you know, this is small, what we've got going on there. And I would say there isn't enough lunch clubs around. I'm sure if there were more, and they were operating on a daily basis, because we operated that club. I mean, at the point when the volunteers decided that they were scared of COVID, I ran the club with the centre manager, and through that time until they were ready to come back again. So we did keep it going, not obviously when we were advised not to, but the minute we could, we did. And it was heartbreaking, really, when people came back. You know, it was really powerful, the isolation they'd experienced. So it was an amazing thing. So yeah, I think it's a really great idea to have a collective, but I think that you know, when you are relying on volunteers, and you're saying in here that it's a bit for moving away from being reliant on local authority. I would say ours isn't reliant on local authority funding, and is probably quite a good model, but it's difficult. I think we need an exit strategy for our team because they're getting older and they'll soon be coming to the club. So it's a bit like that, really. Yeah. So I would be interested to know what the funding is that you've got left over, and also whether when those meetings take place, if I could know about that, then I could be engaged through the club that we've got at Nemca, and just, you know, see how much they would like. I know they're connected with Friends in St Helier. We've got Mary Curtin over there, who's very active, have been very active in the St Helier lunch club, but we do have a connection with them already. But that's one that's been developed outside of this. It's just been you know, it's been a good one.
Yeah,
Anyway.
I just think, just if I can respond to your points, yeah, I don't think we've, the network's got every lunch club in the borough. I think it was prioritised around a number that were originally identified by London Borough and Merton that they were directly involved in. The funding has been to run the project and the network. The funding I referred to is Merton Giving Scheme, which has been running, well, supporting the pandemic since April 2020. And we're just sorting out what we call phase 4 of Merton Giving funding, which goes forward. And that's been visible to all organisations to request funding support in the different phases of the pandemic, essentially, to help them through.
We've actually benefited from that, so thank you.
Good. I'm pleased to hear that. I mean, there's over £650,000 have been deployed since April 2020 through Merton Giving Scheme via 164 grants, separate grants, with an estimated reach of around 25,000 residents based on estimates. So that's been a huge support to many organisations, not just those running lunch clubs in the borough, you know, community, faith, voluntary sector. So you know, that sort of connects to this, but I'm happy to pick up offline, and what I'll probably do is, if you're happy to, is speak to Peter directly, who is facilitating the roundtables, etc., to make sure that you're connected in, and any best practice, as you say. I think the other point you make, which is a very valid one, is many of the volunteers are older individuals, and one of the things I know that's been discussed is trying to get maybe more younger volunteers involved in the lunch clubs. And obviously during the pandemic, one thing we have had is vast numbers of volunteers stepping forward, many of which, to be perfectly frank, we haven't been able to deploy directly. But I think that's part of the opportunity that will be progressed going forward, and the volunteer development of the programme, if you like, I think is testament to that's going to be an important aspect of the future sustainability and viability of many of the clubs. And I also agree with your point that, you know, the more the merrier, because as Chair said, it's a fantastic service. And I know from when I first spoke to the LBM team, their passion actually for lunch clubs was paramount. You know, they just wanted to keep them safe and grow them and make sure they were sustainable long term, because I think all of us understand the huge benefit for many residents that they provide. So I'd endorse all of that. Thank you.
Thank you, Helena.
Thank you, Simon, for the report. Just a question really around the issue that Linda raised around the volunteers and the age of the volunteers. I just wondered if you'd looked at doing any collaborations, particularly as we're coming out of COVID now, with local schools, local colleges, or groups like the Scouts, or groups doing the Duke of Edinburgh Award, because perhaps there's a way of providing a constant supply of volunteers and also improving relations between the younger and the older in our community. And I know there's a very successful nursery somewhere else in South London, which is based in the grounds of an elderly people's home. And they actually find that the outcomes for both the children and the older people massively improve. I think it's in Clapham.
No, I know the model you're talking about, and the evidence I think comes from a lot of sources of that huge benefit of older generation people, you know, working with much younger children and young adults, and the benefit they both get. I mean, there's been a lot of that, a lot of it online actually in the pandemic. It's almost like the befriending model that's been delivered remotely. But I can't hand on heart say how much that's been developed more recently, but I'll certainly take that straight back into the project team and say, let's really, you know, get the wheels under that sort of next step. which we've got an opportunity to do, over the coming year to actually, now we're coming out of the pandemic and some of the restrictions just aren't as severe as they have been, then I think those opportunities, but I think the roundtable network is, that will get things going, because as you say, if there's an example somewhere, not necessarily just in the borough, but somewhere that somebody knows about, we can pull that in and try and get it to work, because I think, like I say, we'd all like more and more engagement, and sensibly, it's a great opportunity for volunteering at all ages, really, and that, as we know, volunteering doesn't come free, but it can be a very viable resource to run all sorts of services around supporting residents. So again, I'll certainly pick that one up and hopefully be able to report on progress another time on that.
Mary.
Got the right button. Thank you, Chair. Thank you, Simon, for your report, and thank you for all you do for the groups in Merton. I just take you to task over one thing, referring to them as lunch groups. They're activity groups who provide lunch.
Yeah.
And I'd like if you could sort of reword that sometime, and it shows more of what we do. I've been involved with Friends in St. Helier for over 30 years. I was there when we just done biscuits and tea, and now we have 7 groups right across the borough. We go from Lower Morden to Mitcham and elsewhere. We provide activities, as you know, and that. But what we do we're not too badly off for funds, because we had a legacy given to us. But we're finding it very difficult at the moment for transport, and getting transport for, not necessarily for go away on holiday, but even for days outings, even just go out to lunch someplace new, to Box Hill, somewhere like that. We're finding it very, very difficult to get any transport at all. So I was wondering if you've got any plans in the near future for providing minibuses at a reasonable rate to groups like Friends in St. Helier. Thank you.
Thank you, Mary. Firstly, I personally suggested that we try to change the lunch club handle, because, as you say, they're activities that sort of revolve around lunch, but not always. It might, like you say, just be a cup of tea or a biscuit or whatever. But so that's why it's in the paper. I think we do need to change that terminology, because I think it sort of sets in a number of people's minds the wrong service, and it's much broader. Just on the transport theme, we did submit a expression of interest, not last Friday, the Friday before, to a Department of Transport fund that was trying to address transport and loneliness, and was looking for innovation in how transport might work differently going forward to help that. So we haven't had a decision, other than hearing that, like most funding at the moment, unfortunately, it's heavily oversubscribed, but that would provide potentially some support to additional transport options, rather than those that, again, have been historically used, if you like. The other thing is what we call phase 4 of Merton Giving Fund, which kicks off in April this year and is planned to run for the financial year, is going to have a strong transport theme in it, because it's very evident when you have 164 different applications for support, you start to see where a lot of the pinch points are for organisations to be able to deliver their service, and transport comes up quite strongly, and it has continued to. Initially, in the first lockdown, it was around lack of IT equipment. So the first phase of Merton Giving, where we had 17 panels in 17 weeks, a lot of that was to do with helping organisations with IT, so they could keep in contact with customers remotely. But like I say, more latterly, transport has come through as a big theme. So there will be a sort of target to try and get more transport options, and accepting the point that was made about Merton Community Transport, to look at other innovations, whether that's a minibus, whether that's more volunteer drivers, whether there are other options that we haven't really explored yet. So certainly be assured that transport will be looked at quite seriously going forward. Thank you.
Thank you. Are there any more questions? Well, I've got one myself, if I may, and that is, at the beginning of the project, one of the key priorities was looking at the financial viability of the groups. Have you been monitoring, tracking their finances, and are they, are there a number that are on the point of financial collapse? Are there some that have strengthened their financial position because of the generosity of the community and the greater awareness of the need to reach out and help such groups? I'd be really interested to know whether what the picture looks like at the moment.
Yeah, thanks, Chair. To be frank, the position that was first looked at with those most vulnerable, those that looked reasonably financially stable and well supported, hasn't changed particularly during the period, because the period's been, there's been a lack of room to sort of develop. I mean, I know there's been a lot of conversation about pricing that they charge for. It was evident, I know, from 2 or 3 organisations that they weren't covering their costs when their costs were looked at. Now, that's always going to be a problematic area. But I remember one of the organisations, they just didn't have the bandwidth to really analyse their costs. And also to look at maybe other options where they could get funding support from other grants, whether they could get some sponsorship. And to some extent, a lot of that has been discussed through the round tables of that reality. But to be perfectly frank, Chair, I don't think we haven't lost any, which is important on the one level, but I don't think the position has particularly changed through the pandemic. Their sort of financial position. I know some have had to pull into their reserves, for example, to be able to continue to operate. But like I say, not just Merton Connected, we've been encouraging them to try and access the Merton Giving Fund, and as part of the work that Merton Connected do is support them on bidding for other, community funds and other things that come out to get them additional finance to keep them viable. But I'm sorry, that's not a very exact answer, but I think I was trying to remember the sort of profile. I think there were probably 3 when they were first assessed that looked sort of at risk almost from a financial sustainability position. And I think those 3 organisations are probably still in a similar position. But like I say, there's a lot of support around them from other lunch clubs that maybe run things slightly different. We know a couple of the larger charities provide pro bono finance support to other smaller charities, etc. So hopefully the network and the roundtable approach, they feel more supported than exposed just in their own right. I hope that partly answers your question, Chair.
Thank you. Any other questions? Okay, but I think the key message to take away is to pass on our thanks to all those involved in this really important service, be they volunteers or staff, or and we admire the work they do and we support it.
Thank you, Chair.
Thank you. Right, so the next item is the work programme, which is published on, well, I mean, the work programme is actually on page 42, looking forward. Can we note the work programme? Helena.
Just on the work plan, and I've raised this a couple of times and on email as well, and I'm not sure what's going wrong. On the meeting date, 8th of Feb. So at the beginning of the year, we agreed 2 items for the work plan. One was the immunisation schedule, which we've looked at today. The other was the cancer screening. So that looked at breast cancer screening, cervical cancer screening, and bowel cancer screening, all of the routine screening programs that take place. We've merged that with the immunisation schedule half, because we talk about breast cancer on page 5, the second row. But we haven't talked about cancer screenings this evening. We've had a report on immunisations only. We do need to have a report on cancer screenings, and it needs to cover not just breast cancer screening, but also cervical, bowel, and any other routine cancer screenings.
Stella?
Chair, apologies to the panel. It was due for February, but I've had a request from NHS England that the data wasn't ready and they've asked to bring it in June.
Personally, I don't think that is good enough. We've been asking for this since last July. We are seeing drop-offs in cancer screening rates during the pandemic, and I think we need to see this data so we can scrutinise it effectively, because if people have got cancer which is going undiagnosed, you know, 6 months does make a big difference.
Stella, can we go back to them and say that members have expressed dissatisfaction with that and ask if they could please provide us with a report sooner than June?
And Chair, that would mean that the report would come in March. I'll ask.
I mean, I don't think we can do any more than that. We are dependent on colleagues from NHS to provide us with information in order that we can scrutinise it. But we can express your views and the views of the panel if that's a view that's shared, and see if they can be encouraged to do so.
Yeah, Chair, just on that, some of the data is already available online, so it just needs to be sort of downloaded and then presented. And I don't think panel members are expecting a report with lots of detail, but just an overview of the situation and the key facts, if that helps reduce the burden on colleagues in the NHS.
In that case, can we go back and say that to them, Stella, and say that we recognise that many of them have been under strain and asked to take on other responsibilities, but we think this is important and we'd like them to present what they can to the March meeting. Happy with that, Helena? Right, can we note the work programme? Well, if I can then conclude the meeting. Thank you all for attending, and in particular to thank the Vice Chair for filling in at the beginning of the meeting, and see you again soon. Thank you.